Hello. We've made this film to aid your understanding about a special test that may be done after your breast cancer operation. Following surgery, several different tests are done on the tumour samples. Surgery removes the tumour, but as some cancer cells may remain in the body, hormone treatment, radiotherapy, and sometimes chemotherapy are used to reduce the risk of breast cancer re-emerging or recurring. These treatments are important as breast cancer recurrence affects longer-term survival. For example, if one particular test shows that the breast cancer tumour is estrogen receptor positive, it's likely that you'll be offered hormone therapy. Your breast cancer team may also want you to consider having a genomic or gene expression profiling test. Research done on thousands of patients with breast cancer shows that the results from these types of specialised tests are useful when deciding if chemotherapy might have a role in treating your cancer. You may have already been given leaflets to read that mention these tests. Chemotherapy is anti-cancer drug treatment that kills cancer cells. It's usually given as a course lasting from 4 to 6 months at the cancer centre via an infusion into a vein. This may take most of the day, as preparing and giving the drugs can require some time.
It has been really tough, actually.
Unfortunately, chemotherapy does cause certain side effects, as it destroys normal cells in the body as well as the cancer ones. Many patients go through treatments easily, but others find coping with the side effects such as nausea, hair loss and fatigue quite difficult. This is why we only want to give chemotherapy to those patients most likely to gain some value from it. Doctors consider a number of things when deciding whether or not to recommend chemotherapy. Some use a computer program called NHS Predict that calculates your overall chances of survival in the next 10 or 15 years. The program takes information about you and your tumour to predict the extra benefit you might gain from the surgery alone or from having hormones or chemotherapy as well. Remember that the point of any of these additional treatments is to reduce the risk of recurrence, as it is this that influences longer-term survival. Now, some patients have types of breast cancer that have such a low risk of recurring that chemotherapy would offer nothing useful, only the unwanted side effects. For other women who have larger tumours or higher risk breast cancers, the potential advantages are much more apparent. However, for some patients like you, when doctors look at all the information they have, the recurrence risk is less clear. And this is why a genomic or gene expression profiling test might be helpful. Genomic tests examine breast cancer tissue removed during a core biopsy or at your original operation, so you won't need to have any more surgery. The tumour samples are sent to specialist laboratories where certain genes inside the breast cancer cells that affect its behaviour, including how likely it is to grow and spread, are carefully examined. Several genomic tests are available. They're slightly different, but all look at the risks of cancer recurring and therefore help in predicting if chemotherapy is likely to lessen the risk. The Oncotype DX breast recurrence score test is the one used at your hospital. This test looks at 21 different genes inside the breast cancer cells. Your doctor is sent a report showing the activity levels of these genes, together with a recurrence score result, which can be any number between 0 to 100. If the score is below 25, this is considered lower risk, and so the addition of chemotherapy would be unlikely to increase the benefit given by hormone treatment alone. However, if the score is 26 and above, the breast cancer is at a higher risk of re-emerging, so chemotherapy would most likely be recommended, together with hormone treatment to reduce this risk. Now, some research suggests that your age or menopausal status might affect interpretation of these scores. So if you're younger than 50 or premenopausal, and the recurrence score result is less than 25, then chemotherapy may offer some benefit which needs consideration. Some doctors will use printouts with graphs to help when discussing these results with you in more detail. In summary, you have early-stage breast cancer, which is estrogen receptor positive, requiring hormone therapy. Doctors are not sure if chemotherapy is really necessary, so they already have or wish to send off a tissue sample from your tumour for specialised genomic testing. Unfortunately, no test can predict for certain if the breast cancer will re-emerge or not. However, we are seeing more and more research from thousands of patients showing that these genomic tests do provide a pretty good estimate of the recurrence risk. Whatever the result, it's important that you discuss options with your cancer team. They'll help you to weigh up the likely advantages of chemotherapy against its potential side effects and whether or not it has any useful role to play in your treatment.